Hello friends, I'm Dr. Swati Kanakia, a Pediatric Hematologist Oncologist from Mumbai. This is a series of patient education initiatives which are designed to help parents dealing with children having cancer. It's not meant to give medical advice, and it cannot replace your doctor. So please consult your doctor at all times. Over the last 20 years, I have been repeatedly asked certain questions, and I would like to share my experience with you all today. So, all of us have experienced nausea and vomiting at some point or the other. While nausea is an unpleasant sensation of just wanting to vomit or just like feeling like vomiting, vomiting itself is throwing up, bringing out everything that is there in the stomach or everything that has actually been eaten. So, what can you do to prevent nausea and vomiting in a child who is receiving chemotherapy? We have wonderful drugs these days which take care of most types of nausea and vomiting. So, before we go on, let's understand the different types of nausea and vomiting. If the sensation of nausea or vomiting itself occurs before or in less than 24 hours of chemotherapy or radiation therapy, then it is called as acute nausea and vomiting. If it happens after 24 hours, it's called as delayed or late nausea and vomiting. And sometimes the child learns to associate certain sights, certain smells, certain experiences with the chemotherapy. And this happens in children who have already received 2 or 3 cycles of chemotherapy. They have experienced what is nausea and vomiting. Then they make this association, and even before giving the chemotherapeutic agent, the child vomits. We had a child many years ago, before all these new fancy drugs were available, and she would vomit even as she passed by the hospital and was not even given any kind of chemotherapy. And this is called as the anticipatory nausea and vomiting. So what is it that you can do to prevent this? Of course, the medicines, as I told you, will be given by your oncology clinic. So what is it that you can do as a parent? Please remember that there will be changes in taste. Okay, so try and identify the preferences of the child. What is it that he or she likes? Give small amounts of food, sometimes even 5 to 6 times a day if necessary. You can give the child sweets with a lemon flavor or orange flavor or certain mints. Always serve the food at room temperature. Don't give it hot, so that the aroma, the smell of the food goes down, and that will not stimulate further nausea and vomiting. Also, you must increase the fluid intake because the child is bringing out so much, you would like to replace it. The child may or may not have liquids straight away, or water, for example. What you can do is make having fluids fun. So get different sippers, get straws, let the child have fun, let them try and suck in different fluids. You could give sharbat, you could give limbu pani, or any of these things through a sipper or with a straw. You could also freeze it. A lot of molds are available, ice cream molds, kulfi molds. So you could put it in the molds and then give it to the child. You can also allow the child to suck on ice cubes. What is it that one should not do? We know that there will be certain food preferences. So don't force the child to eat his favorite foods while he's nauseated or he's feeling like vomiting. This may cause a permanent dislike of the food. So don't force feed is the whole thing. Also avoid any foods which are very spicy, which are very salty. They are deep fried. They have a lot of masala in it because these tend to have a very strong smell, and this will again stimulate the vomiting center. So this is something that has to be avoided. Also avoid food for 1 to 2 hours before treatment, whether it is radiation or it is chemotherapy, because that might worsen the sensation of vomiting. And do not allow the child to lie down for at least 2 hours, 1.5, 2 hours after eating food. You could put him in a propped up position, means semi-sitting or semi-sleeping. There are some other non-diet or non-food related things that one should try. Avoid any strong or unpleasant odor, means smell. Again, it will stimulate the vomiting center. So you don't want them to feel extra nauseated. Allow fresh air into the room by keeping the windows open. Talk to the child. Explain to the child that, well, there's nothing that's going to happen to you. You're going to go back home. It's only a morning to evening chemotherapy. It's for a short time, and things like that. That will calm the child. That will reduce his anxiety. You could play soothing music if the child likes it. The problem of today's children is that even normal children don't want to have food without either a TV or a mobile phone or any gadget or even a tab. They're constantly watching this, even when they're admitted in hospital. I would advise parents not to use these gadgets because of the visual stimulation. They tend to get more vomiting. During an episode of vomiting, so if the child has thrown up, then what are you going to do? Don't keep the child lying flat. Turn him over to one side like this. Why do we do that? Because if the child is flat and he vomits, there might be aspiration. That means the food particles or the liquid might accidentally be inhaled into the lungs, and this could cause a problem. So we do not want that. Also, another very important practical point is that very often these children are in the hospital receiving chemotherapy when they vomit. The IV line, which is there on the hand, or there could be an IV line through the PICC line or through the port, this might accidentally shift because there's a sudden motion. Okay. And if that happens, there might be extravasation. The chemotherapy might start leaking out and give rise to a lot of problems. So just keep an eye on the needle through which the chemotherapy is going. Well, friends, thank you very much for watching and listening into this video. I really hope that this is useful to you, or it's useful to anyone that you know. For more such videos, you can always look up our channel. This information is for parents and for patients only, and it really is not meant to offer any kind of medical advice. It cannot replace your doctor or a consultation with your doctor. So please be in touch with your doctor at all times. Bye. Thank you.